Hello everyone. In my previous two videos, I have spoken about the symptoms of pancreatic cancer and how pancreatic cancer is evaluated. In this video, I will talk to you all about the treatment of pancreatic cancer. Surgery is the main treatment of pancreatic cancer, and there can be no cure without surgery. So pancreatic cancer, after evaluation, are broadly classified into clearly resectable tumors, borderline resectable tumor, locally advanced tumors, and metastatic tumors. So clearly resectable tumors are small tumors located within the pancreas with no challenge involving the blood vessels or lymph nodes. These tumors should go for surgery. The surgery will depend on where the tumor is located. 60-70% of the tumors are located in the head of the pancreas, and the operation which is done is called a Whipple's operation, in which the head of the pancreas is removed along with part of the intestine known as duodenum, part of the bile duct, and reconstruction is done by bringing the small intestine up and joining it to the bile duct, to the pancreas and the stomach. It's quite a complex operation and it requires a great deal of experience to do it properly. A critical question always before surgery in patients who are deeply jaundiced is whether to insert a stent in the bile duct so as to reduce the bilirubin or not. For lesser levels of bilirubin, stenting is not to be done as it increases the chances of post-operative complications. Stenting is done in two specific situations: when the bilirubin is very high or when the patient is nutritionally depleted, making immediate surgery difficult. It is also required if modalities other than surgery are done first. The next tumor is a borderline resectable tumor, where there might be some doubt in the mind of the surgeon whether he'll be possible to remove it or not, or there may be complex reconstruction of blood vessels which is required. Here the treatment is chemotherapy first, what we call as neoadjuvant chemotherapy. The chemotherapy is also of various types. In a younger patient, we maybe go for a more aggressive type of chemotherapy given by the short name FOLFIRINOX, or a less aggressive type of chemotherapy. After chemotherapy, we usually take these patients up for surgery. If the tumor has shrunk well, the surgery may be a little more easier and the chances of leaving behind microscopic disease will be lesser. The third type is locally advanced, where there is clear involvement of major blood vessels, making surgery almost impossible. In these cases, we go for chemotherapy and sometimes with radiation. In some cases, the tumor might shrink enough, making surgery possible, in which subsequently surgery is done. In those patients where the tumor has spread to far off organs, to liver or lungs, or we might consider for what we call as palliative chemotherapy, where cure cannot be achieved and the aim of chemotherapy is to prolong survival and improve the quality of life. So these are the various treatment modalities available for pancreatic cancer. Thank you.